Hello and welcome to Policy and Politics with me, Tarun Nangia. We continue our conversation with Mr. Indu Bhushan. He is CEO of Ayushaman Bharat, or PMJ as we call, the Prime Minister's health scheme. In the first part, he discussed with us that how many people benefited under Ayushaman Bharat till now, around 3 crore, 3.2 crore cards. The card entitles you to a free treatment up to 5 lakh rupees, and his target is 55 crore. It's quite an onerous task for any government. 55 crores, let me tell you, 55 crores is not the population even of the United States of America. So that is the number we are talking of. United States must be about 37, 38 crore, and Mr. Indu Bhushan is going to issue cards to 55 crore people. We are going to discuss about what this challenge is like. Mr. Indu Bhushan, welcome again.
Thank you.
What is this challenge like? You are issuing cards to a number of people which is about 15-18 crore more than the population of the entire United States of America.
What helps us is that we have a robust IT platform, and that IT platform, together with the availability of Aadhaar as a unique identifier, I think it's quite easy for us to issue these cards. But issuing these cards is not the major objective of the scheme. It's providing services.
Yes.
And people who come to seek services, they'll be issued cards. And actually, anyone can go, and we have a website called mera.pmj.gov.in, and they can check whether they're part of the scheme or not.
You must make a note of it, mera.pmj.gov.in. You will see this link on the screen, on your screens now. You can go to that website.
Yes. And so, actually, in the initial phase, we were thinking that we'll not issue so many cards. We'll just issue cards to those people who will come to seek services. And in general, it's lucky that not everyone falls sick. So after in about 50 crore people, our guess is about 3 to 4% people are going to be falling sick and needing hospitalization. That means about 2 crore people every year.
Yes, 2 crore people every year will be treated.
Will be treated.
Yes.
So that's the goal. So issuing card to 2 crore people is not a problem. Actually, as you can see, that in first,
you've already done 3.2.
7 months we have issued 3.2.
I want to understand from you, just because our viewers would also want to know, what are the maximum kind of operations that have happened in the past 7 months? I mean, is it heart operations, or are they cataract operations? What sense of treatments have been given to people?
See, this scheme is for serious illnesses. So if you look at where the money has gone,
yes,
the 4 major areas have been cardiology,
yes,
where a lot of I think resources have gone. About 1/3 of our resources
are for cardiology, which means health is
related to heart. And then oncology, cancer-related treatment has been quite high on the list. Then after that is actually orthopedics, a lot of hip replacements, knee replacements, and major orthopedic surgeries. And finally, it's urology, hemodialysis, and that kind of support.
So there you have it. Mr. Indu Bhushan shares with us heart operations have been done under Ayushaman Bharat, urology operations, maybe kidney-related ailments. Then he also spoke about
oncology,
cancer. Which is cancer. Of course, cancer, as we all know, has been increasing in a sense.
And orthopedics.
And orthopedics. A lot of old age people do have orthopedic problem. I think in a sense, it is very useful for a lot of poor people who are old age in India, because I think that's a problem that troubles most for people when they
actually, these numbers don't tell you the full story, but if you look at people who've been benefited,
yes,
that's sometimes very touching. You will meet people who were not able to walk for last 10 years.
Yes.
And because of this, now they're walking.
That has also happened.
And, Honorable Prime Minister met a woman in Ranchi.
Yes.
And she told him that she couldn't walk for last 3 years.
Yes.
But now she can dance, and she showed
because of this.
Because of
being treated under.
Because of this treatment.
There is a problem I see here, that enormous demand will be created now, because everybody would want these cards. Because if I see my neighbor having one, then why don't I have one? Is the government ready to push it so fast? And
Absolutely.
What kind of challenge does it prevent?
Well, you're right that once the scheme gets going, it will create its own demand. And one person gets benefited in a village, the whole village would know about the scheme and would like to be part of the scheme.
But politicians will be ranked on their ability to get it implemented.
Yeah, why only politicians? Administrators and people like us will also be ranked on how effectively we can run the scheme.
And I want to, please.
So implementing this, of course, will have challenges, but our aim is that it reaches all 50 crore people, and if they need services, they should use the services. That will be the success that we are seeking.
Now, coming back to feedback, you are sitting in Delhi. You have 50 crore people, or as of today, 10 crore people who will be eventually benefiting. Of course, not all people will fall in, but of course, there will be people. But I have a complaint. If I have a complaint, how do I get to you?
Well, we actually have a very robust grievance redressal mechanism, and people can either call a number.
What is the number?
14555.
14555. If I want to complain, if any hospital or insurance company is not giving me service.
Exactly. So you can either call that number, or we have a website again, this mera.pmj.gov.in.
You also have a mobile app where I can complain?
Yes. So we have a mobile app, PMJ mobile app, and that can also be.
And how quick is your redressal?
Well, frankly, it depends about the kind of complaint that we have. We monitor it very closely on weekly basis, and we make sure that a response, and many of them actually call us directly, and they tell us that because these are emergency cases, and we resolve them within a few hours.
Okay, it's only 7 months now, but for any robust system to be robust, it needs audits.
Absolutely.
Are you looking at some time in the future where you'll have third-party random audits to check if the feedback mechanism and the response is working well? Because I think on that hinges the success of the scheme.
We will have those, and actually much more, because you're right. First of all, we'll have audit of our own. We are planning to, or not planning, we are calling 100% people who get benefited. And we call them, and we find out what was their experience, were they charged money, are they satisfied or not. If they're not satisfied, and if they tell us that they were charged money, we take action. We get in touch with the state and report it and ask them to follow up, number one. Number two, we'll be taking about 2 to 3% of medical audits, that we'll go pick up randomly 2 to 3% cases and go through whether those services were needed. There was no abuse. For example, if the stent was given, was the stent needed?
No, but you mean in a sense, will you appoint somebody as a third party regulator?
No, we'll do it ourselves, because that's a self audit I'm talking about. And then we'll also have independent evaluation of the scheme based on many of the parameters that you mentioned, and it will be done by independent people, and evaluate the scheme and tell us where things have worked, where they've not worked, and what kind of changes we should make.
Okay, now I want to know that, for example, we take 2 states into question, Uttar Pradesh and Bihar. We see a lot of patients from these states coming to AIIMS in Delhi for treatment, because traditionally in UP, except for Noida and these areas in the north, infrastructure is not as good. Lucknow, of course, to some extent is good. In Bihar, I think except for Patna, a lot of rural Bihar is not doing that well. Which are the states which are showing the maximum migration? Because you told me that I have my card, I can take it to Bombay for treatment. If you give me an example of Bihar or UP and share with us.
You're right that we see a lot of people coming from Bihar going to other places. I think it's because of 2 factors. One, lack of services in Bihar, but also there are a lot of migration from Bihar for labor migration. A lot of people from Bihar and in other states.
So they're already there in those
already states. There, and they can seek services. And a lot of people actually come from UP come to Delhi because of the proximity. And we've seen that a lot of people from adjoining part of Uttarakhand
Yes.
have been going to Rishikesh, AIMS, and seeking services there. And for different regions, I think there are different magnets. For example, PGI Chandigarh.
Yes.
They are getting a lot of patients from Himachal Pradesh
Yes.
or Haryana, and similarly AIMS here get a lot of patients from the neighboring states, but also they get a lot of patients from Northeast, because anything that requires higher level or tertiary level care in Northeast, Northeast also has a problem of tertiary care not being available
Yes.
there. So a lot of people come from Northeast as well.
Okay. Now, one thing that public may demand, that you cover a lot of serious illnesses.
That's correct.
But a lot of old age people, specifically, if I may say so, require a lot of OPD treatment. Is there a possibility that you may cover this in future, or do you think it's too early days yet to think of it?
So I can't predict about the future, but many of the existing programs in the government cover OPD, and
They do.
They cover OPD.
Yes.
And also the other leg of Ayushaman Bharat, which is health and wellness centers.
Yes.
So government is planning to establish 150,000 health and wellness centers,
Yes.
Which will expand the capacity for providing these OPD.
Or do you think the problem is because it's so difficult to monitor OPD expenditure that it could be faked easily, and that's why it's preventing you from launching it?
Well, at some point in time, we'll have to take that head on. But right now, we wanted to start with the serious illnesses that require hospitalization.
Urgent.
Because, because we have to start somewhere, right?
Okay.
And so these have been put in place.
Now, what we give hospitals today, various governments, we give hospitals a 2.5 FSI so that they can build bigger buildings. We give them subsidized electricity, subsidized land, and they're allowed to treat, they're required to treat 10% patients from the lower socio-economic strata free of charge.
Free of charge.
With the coming of these schemes, have the hospitals absolved of this responsibility, or they still will have to treat those persons?
They'll still have to treat those persons,
Yes.
10%, but they can think of a tiered pricing.
Yes.
They are treating these 10% people free,
Yes.
but on top of that, they can have people from Ayushman Bharat for which they'll be paid.
Yes.
And on top of it, maybe they can have private wards and 5-star services for people who can really pay.
Yes.
So the whole structure will be that there'll be some element of cross subsidy across the whole thing. But we want to make sure that our rates,
Yes.
or what we pay, will be able to cover their marginal cost.
Marginal cost. Okay. Very interesting. On this note, we'll take a short break and we discuss with Mr. Indu Bhushan after the break, and how the scaling up model, where on a factory shop floor, when you scale up production, the costs come down, how that can be made applicable to Ayushaman Bharat, and we will discuss that in detail, but that's after the break. Welcome back. Just before the break, we discussed how many people benefited under Ayushaman Bharat, the kind of pitfalls, would OPD be included. Now we move ahead. We also discussed complaint mechanism. Now we move ahead. So we had a leading doctor who is promoting a chain of hospitals speak to us, and he told us that in factories where you produce cars, when you scale up production, the costs come down. If in a Medicity I do 500 heart operations a day, my per operation cost comes down drastically. Can India have a model where there are Medicities which have got 5,000, 10,000 beds and who do Ayushaman Bharat operations, or do you think this is very far-fetched as an idea? Because we are having Medicities which are treating foreigners. Can there be Medicities which do mass operations? Because you're speaking of serious illnesses. So if I know a heart center which does 2,000 or 1,000 heart operations a day under Ayushaman Bharat, and then people can gravitate. So if in Bihar, if there is such hospital, say in Patna, which only does heart operations, anyways it will become a center of excellence because they're narrowing down their focus. And then you have all people coming. Do you think this is the future of Ayushaman Bharat?
This is feasible, and in general, our approach has been to change the current model of low volume and high margin in private hospitals,
Yes.
to large volume and low margin.
Yes.
And so we will assure hospitals, not only hospitals, but also manufacturers of devices and drugs and pharmaceuticals that will give you large volume, but in return give us low price.
Yes.
Because we'll assure large volume. So we can negotiate with these devices manufacturers and manufacturers of drugs and prices, tiered pricing. That for Ayushaman Bharat, PMJ, please give us lower prices as compared to what you have for other people. And similarly with the big hospital chains, they will get larger volume, so economies of scale should work, and they can reduce the prices. That is our vision, and we hope that we can implement that because going forward. Because as you were alluding to earlier, that when the demand increases, when there is a lot of pent-up demand right now for treatment of, say, cancer or cardiovascular diseases, and when that demand comes to surface, how will we afford it? We'll afford it by reducing the prices through this collective bargaining process.
Okay, and I must say that such facilities should come to India, because it shouldn't happen that we have issued 55 crore cards and people have to wait 6 months for an operation simply because enough hospitals are not present. And I think that will be your headache the day you manage to distribute, which I think you will in the coming years.
And Tarun, one other thing I want to say is that the technology is going to help us in going to scale.
And how is that so?
And technology, including artificial intelligence and machine learning and telemedicine, because one of the biggest constraints right now that we have is the skills, because training a doctor takes 7 to 8 to 10 years. And if we look at, say, treatment of cancer, we have only a limited number of doctors who are trained in cancer treatment. And so once we want to expand the services, right now about 15 lakh people get cancer every year. And we cover, we as a system cover only a partial fraction of those people, because we don't have the capacity. So if we can have this telemedicine or use the existing doctors to treat those, and in the process also train doctors in a decentralized fashion, that can work. So I think technology of telemedicine, artificial intelligence and machine learning should help in terms of going to scale.
You mean, when you say this, you mean the next 3, 4, 5 years?
3, 4, 5 years, and also maybe in the future too.
Okay. Now, any scheme in India is prone to a certain kind of fraud that happens. So people try to call up and fool people that I am empaneling you under Ayushaman Bharat, give me 5,000 rupees and you'll get free treatment of 5 lakhs, whereas government is not asking for a single rupee also. What are things that people should be wary of, and have you caught anybody cheating?
Tarun, we've seen fraud at different levels. First of all, we see mushrooming of websites providing information on Ayushaman Bharat and asking people to get registered and asking for some money. So we are continuously trying to get those websites. Websites are down, and trying to see if we are filing FIR against people who are doing this. Then there's some rackets, they pretend to provide jobs for Ayushaman Bharat, and we unearthed one scam recently and filed an FIR, and about 6 people were arrested. They were making calls and asking people to get registered, and they were asking for money in lieu of providing jobs. So also we found some on Play Store, a lot of apps, fake apps, and we've actually
you reported it too?
Yeah, we've also brought them down. We've been in touch with the Google Play Store, and they have taken off all the apps of these forged apps. But also we found at some places at the hospitals also some indication of abuse, where customers or the beneficiaries were charged money.
Which means even hospitals can fake it and they have to report to you.
Yeah, so actually hospitals didn't fake it, but they provided treatment, but instead of providing free treatment,
they charge money.
They charge money, and in that such cases, we've got some hospitals suspended, and also we've penalized them. They had to pay back 4 times what they charged.
But this is for you viewers. You have the man who runs Ayushaman Bharat himself telling you that no money, no hospital can charge you money under Ayushaman Bharat.
It has to be
it's
cashless.
100% cashless,
Yes.
100% free of cost. That is in a sense USP of the scheme, that you can't be charged.
Exactly. So no money for drugs, no money for diagnostics, no money for services, no money for food.
Yes.
And also they should be provided money or they should be provided medicines for 15 days after their discharge.
Let's go through this again. No money for food. No money for treatment. No money for
drugs. And no money for
drugs
diagnostics.
as in medicine.
Yes. Yes. And no money for diagnostics.
100% free.
100% free.
So if you don't get it 100% free, you have to call the numbers that Mr. Indu Bhushan just gave us. You also see it on the screen and complain. So
absolutely.
I want to ask you my last question, that since the scope of the scheme is so large, do you think a Delhi office suffices, or would you need an office in each state capital to agree to the consumer complaints? Do you think a central office is enough, or you need a local proximity? You need an office in Patna, Lucknow, going forward it could be Bombay, so many places.
Tarun, we already have offices in each state.
You do.
And so the National Health Authority
yes.
Is coordinating at the national level.
Yes.
But the implementation is being done by states, and they've established what is called SHA, State Health Agencies.
Yes.
And they are actually implementing the scheme.
Yes.
And in most cases, they've established their own call center,
yes.
their own grievance mechanism,
yes.
and own what we call SAFUs,
yes.
state anti-fraud units,
okay.
to look after any fraud cases that they see. And each state has their own either insurance agency or a trust which will make payment to the hospitals, and they are managing it. Actually, we provide them support through training and IT backbone and many other support, but actual work is being done at the state level.
Now I want to understand, any scheme will have a lot of criticism from people, and there is a go as you learn model. There is criticism, you learn from it, and then you improve. What has been the learnings for you in the past 7 months which you plan to implement in the next 4, 5, 7 months?
Well, even for learning, 7 months is not enough, because yes. Feedback. But
takes
actually,
time.
But on the other hand, we learn something about it every day.
Yes.
And for example, we found that earlier,
yes.
We had given this 6-month window for pre-authorization.
Yes.
So if patient comes to hospital and the person, then doctor says, okay, this person needs this treatment.
Yes.
Then state has to pre-authorize, okay, fine, you can go ahead and do the treatment. So we wanted it to be fast.
Yes.
And so we had given this, that state has to come back on 6 hours time.
Yes.
But we found that in some places, they were, if they don't come back in 6 hours time, it will be deemed approved.
Yes, deemed approved,
automatically. So, but in some states, we found some private hospitals, they will file for pre-authorization request 11 o'clock in the night.
Yes.
And because they may think that there is no one there,
yes.
and sometimes by 5 o'clock in the morning, it will be automatically approved.
Yes.
But we said, okay, no, that is not the correct system. Let's have 6 hours during the day. Yes. So we'll get 6 working hours rather than 6 hours per se, so that we can stop any potential.
So these are small learnings in Goa.
So we learn about it every day. Actually, we have this meeting every Monday with all the state coordinators, yes. And we have feedback, and based on that, we continuously making changes to our IT platform. Yes. The guidelines are revised based on this feedback. So I think learning takes place almost on daily basis in this scheme.
Okay. But we must say that Mr. Indu Bhushan has got a very interesting job, responsibility, ship to lead. We want to do a 1-year review of this scheme, because today, as we see, it's just 7 months. To talk of any scheme in 7 months is itself the review should be done after a year, for even an audit is done after a year. We feel personally at NewsX that all hinges upon there is a song which says that all I need is money. I think Mr. Indu Bhushan is going to say it often, all I need is money, I'll give you 55 crore people treatment. It remains to be seen whether he'll continually get this money. Governments may change, come and go, but will the allocations come on time, even in revised estimates, on which hinges the future of the scheme? And because then people will complain if they're not treated. So a lot of things are linked, but we await to do a yearly review at his office.
Absolutely.
But for now, I would like to thank him for sparing his time for this two-part episode of Policy and Politics on Ayushaman Bharat, or the Prime Minister's health scheme. Thank you so much, sir, for joining us.
Thank you, Tarun.
Thank you. Thank you.